The next stage of development that I'm going to be talking about is gait in childhood. So basically at this point they should start transitioning into the adulthood gait phase, which is when they're more stable and the faces are going to be more clear and more smoothly. So at this point they will no longer need a wide base. This is because they're able to maintain balance a lot easier than they were in early childhood, and this is also why their stride length is now proportional to their body. They don't need to take those shorter steps because they can maintain balance easier. So they can take normal size steps, and the arm swing is going to be normal, which is going to be opposite arm to opposite leg movements. And so this is when they'll start walking normally as they would when they're an adult. So the wide base and the short stride, as I mentioned before, are no longer needed because they can maintain balance a lot easier. And so this is when children might still be walking on their tippy toes, but should not be most likely, and you'll start to see them outgrow those phases, and this is when they'll be the cycles phases that we're used to seeing and talking about in the gait development. You can start to see them clearer because they have control, they don't have to walk fast, you can see their steps, and the transition of weight is a lot easier to see because of the fact that they're not rushing or wobbly or off balance. So as far as abnormalities within this stage of development, this is when, if you see your child is past the age of 3 and is still walking on their tippy toes, at this point it would be cause for concern, so you should probably start talking to a doctor at this point. Some other abnormalities that may take place is if a child is favoring one leg more than the other, or not wanting to put weight on one leg as much as the other. This could be a sign of muscle defects or muscle weakness, which you should talk to a doctor about as well. There's also abnormal hip movement, which is when the hip is too open when walking or too closed, or not just a normal fluid motion. So there's also a few other abnormalities that I'm not going to mention, but that would be obvious to be seen if a child is walking and having problems or struggling.